we'll go a little bit into why down cows are an issue, kind of where we are historically, because I think that helps kind of frame what we know a little bit about what's happening on farm. So some of the work that my group is doing in this area is fairly, well, we have some results, which I'll share, which is great. And there's other stuff that's ongoing that's actually like in analysis right now, so it was almost ready, so I can share a little bit with that. But we've got a little bit more onto that last part, which is how we can maybe improve. Okay, so down cows, not new. I gave a talk kind of on a kind of broad perspectives on down cows at the American Association of Bovine Practitioners last year, and this is their proceedings from 36 years ago, so 1988, when it was in Calgary, and they were talking about down cows there. So Victor Cox, who I'm going to cite some of his work as we talk about this, gave a session on managing down cows. So the problem of down cows definitely is not new, but for sure there's been a lot of change. Up until about the end of the 1990s, down cows could go here. We could put them on a truck, they could go to slaughter, right? In Canada and the US, and that's not that long ago that could happen. So changes started happening kind of in the US and Canada in the early 2000s, and in Ontario, you couldn't ship any down cow, but you could ship some down cows, right? So OMAFRA appointed veterinarian had to inspect the cow and deem that it was okay or humane for that particular cow to be shipped, and they got a tag and all that. So that happened up until 2008, which is when I graduated and started in practice. So I never had to tag any down cows, but that practice just ended then, which again, I feel was not that long ago. And definitely was not that long ago in terms of like, we think about the average age of a dairy producer in Canada. So lots of change has been seen over time, and now of course, the only time you could theoretically ship a non-ambulatory cow would be if they're going to a specialty hospital or something like that for care. And same thing in the US too. And those changes happened around the same time. We have also like lots of evolution in terms of technology. I mean, I'm not going to talk about preventing down cows, which obviously is a pretty big issue. And I think we've made lots of progress there in terms of like transition cow health and all kinds of things, facility design. But at the end of the day, sometimes there are down cows, and that's kind of what this research is on, how we manage those cows. But yeah, lots of technology has changed, right? Some automatic scrapers, which if there's like a load jam, can go directly to someone's phone to give them an indicator that there's an issue. So, you know, I talked to somebody not that long ago that had this happen. Of course, it was right after they checked the barn and went to the house for the night, and then they got an alert on their phone, went back to the barn, a cow in the dry pen had slipped or fallen or something, got stuck, the scraper stopped when it got to her, they got alerted, they were able to help lift that cow, put her on the pack, and she looked good in the morning, didn't go down again, but that person noted, right, like if they didn't have that technology, they wouldn't have seen that cow till the next morning. So definitely lots of progress in many different areas, but for sure, there's still a challenge. So this is US data, but I think pretty similar in Canada, that most farms are going to experience at least one down cow a year. And of course, there's huge like risk factor stuff that we won't go into, and of course we can, you know, make improvements on preventing these. But they do happen, and they can happen for lots of different reasons. So it could be a health-related event, an injury, something like that. And they, of course, have economic costs and welfare concerns. But one of the other issues is managing down cows is challenging, and they tend to be, or not tend to be, because it's not very many, but sometimes, right, moving these cows can be a risk for abuse. So lots of the videos that happen with animal rights activists, some of those videos have been inappropriate moving of down cows. So how we care for these non-ambulatory cows is going to be important, not just for the cow, for their welfare and prognosis, but I think also from a sustainability and image standpoint too. Okay, so what are down cows? They are cows that can't get up, so not very exciting there. So a couple definitions though that I want to go over. So yes, down means cows that can't get up. So unable to stand without assistance, blah, 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 the cow can't get up. But there are other definitions that are out there too, which are attempting to kind of differentiate any cow that can't get up from a cow that now has additional problems. So these are sometimes called downer animals. Sometimes the way these terms are used in the literature is kind of all over the place. But generally the idea is that there's a difference between a cow that's just down and a cow that has been down for a period of time. So sometimes it's defined as like she can't get up after 12 or 24 hours, or she was treated for primary milk fever, now she still can't get up, or we think that there's secondary damage. So that's the thing that I think is important to differentiate. A cow that just goes down has whatever wrong with her versus a cow that now has some additional problems because she has been down. Also, some of the literature defines this differently, as a dying cow is different from a downer cow in a cow that's in lateral recumbency, can't right themselves, looks very, very dull. So some different words there. And I think the important part here is down cows can turn into downer cows because they're so big, right? So unless the initial cause as to why they went down is treated and resolved quickly, which sometimes can happen and sometimes is more challenging, but they can end up having continued recumbency because they end up getting damage from just being down itself. If they try to get up, and this can be on their own, they can certainly even do damage themselves, or maybe if they're helped in different ways, could potentially do damage there. And if their care and management is poor, this can also increase risk of secondary damage. So now we have this secondary problem of whatever caused them to go down in the first place, but now we have secondary problems. So one component of this is compartment syndrome. So this is, I couldn't find a good sketch of a cow leg. This is what a human leg in cross section looks like, but it's pretty similar to a cow's back leg, just different proportions of muscle group. But you've got the muscles running down the leg, and they're all kind of in these like fascial boundaries. So there's kind of like thick tissue that surrounds this. So you've got muscles, nerves, arteries, veins, kind of all running in a little tube. And what happens is we get pressure or damage in an area, which increases the amount of pressure in that compartment, which then reduces the amount of blood flow. So then you get like lack of oxygen to that tissue, which then causes edema and kind of fluid pooling, which then increases the compartment pressure. So it's kind of a vicious cycle where we have an injury in an area or pressure in an area, and we end up getting more and more and more pressure and less blood flow. The hamstring is the one of these groups that is particularly at risk, and especially in cows too. So the hamstring has really thick boundary around it. And then also when we look at how cows lay, this is where I think this has a little bit higher risk of happening, although compartment syndrome can happen anywhere in any muscle group. So a cow lays normally. This cow in particular had milk fever, but she's laying fairly normally for now. And yeah, depending on how they lay, if they're laying like in sternal, on the front end, their sternum is taking most of that weight. So not a lot of weight is actually on their front legs. And then for their back legs, a ton of weight is on that one back leg that's underneath her body. So depending on how they lay, there's different amounts of pressure that they're exerting in those muscle groups. And so if they lay kind of in that short position up there, or even the long position, there's increased pressure in the hind leg, especially in that hamstring group. So that's why it's a little bit more at risk. How the cow lays can really change that intramuscular pressure, which I think really highlights the difference between, because cows obviously lay down normally, and they normally do not get compartment syndrome, even if they're big and they're laying down. But normally when cows lay down, they only lay down for a period of time. And they reposition themselves as well. So I think down cows that can reposition themselves this is good because they can sit in positions that are comfortable versus cows that cannot reposition themselves are much more at risk because depending on exactly how they're laying, they may have really high pressure in a muscle group. Some of the work that was done by Dr. Cox, whose work was in that 1988 conference, is really important, I think, to understanding down cows. I don't think it would pass an AUP now, but what they did then was induce recumbency in cows. So they just put them under general anesthesia for periods of time and saw what happened. And you can definitely induce Downer syndrome in a healthy cow by just having them not get up for a period of time. 6 hours was the smallest amount of time that they did in that study, and a lot of cows did not ever get up again. The ones that did had varying amounts of damage, and that probably reflects the differences in kind of how they were laying. So when cows are down for periods of time, we can get that compartment syndrome, which isn't very good and doesn't have a great prognosis. We can have other kinds of secondary damage that can happen too. This can be as a result of increased pressure. This can be a result of struggling to get up. But things like muscle tears, nerve damage, fractures, and then all kinds of secondary stuff too. Observational studies that have kind of looked at how common these things are find that, again, depends maybe on where you look and how you're defining everything, but in studies where they're looking at cows down for at least 24 hours, a lot of them have some of these secondary types of damage. So example of this is how this cow is laying here. So cows that kind of creep around the pen or crawl. If their back leg is extended like that, that risks some damage to the femoral nerve root. So depending on how they're moving around, they can kind of put themselves at risk depending on what they're doing. So some observational research that's been done in the past to look at predictors of recovery, look at all kinds of different things, and of course down cows are down for many different reasons, but when we look at kind of if they've been down for at least 24 hours, what are their chances of getting up and what's it related to? And one of the strongest predictors of recovery in these studies is nursing care. So it's defined differently depending on who's looking at it, but generally reflects lots of different aspects of management. So having like deep bedding, having feed and water consistently provided, repositioning the animal frequently, moving them depending on where they go down to an appropriate location, and just kind of general care and management. And so I think the interesting thing here too is that when they kind of define, okay, what's nursing care, and this is looking at observational studies, so what's actually happening out on farms, this is associated with recovery and it doesn't have to be perfect. Because when they're defining this, some of these were defined as half of these things done as a best practice or all of them done with 50% efficacy. So doing this 50% or better of the time, if we look at kind of what the best thing on each risk factor would be, really increased risk or chance of recovery. So the first one there are just cows down without any sort of additional interventions, just looking at differences in nursing care. So if they were in that category of doing at least half of those things well, 30% recovery versus 0 to 8%. The next number looks really great. That's a flotation tank study, but 60% versus 11%. So even with a flotation tank being implemented rapidly at that 24-hour mark, nursing care was a very big predictor of recovery, even for all the cows that got floated. And also when they look at extended periods of recovery, so like cows recovering after like 7 days of being down, again, that was only seen in the farms that had that good to excellent nursing care, which is just doing 50% of what they defined as that. Okay, so what are we doing? So I just want to introduce here, this is John Brindle, who's a PhD student who's finishing up with Dave Renaud and I on the Down Cow project. And so he's already worked on a producer survey and a veterinary survey looking at what's happening on farm. And this is the stuff that he's just in analysis now, which is the focus groups with dairy producers and interviews with veterinarians, trying to look at more of the why behind the practices and looking at the challenges and barriers. So I'll just share a few things from the management survey that we looked at. So first thing I wanted to share here was respondents were asked, how do they move their down cows? So you could have also selected that they don't ever move down cows, but this is relocating cows. They go down in an area that they can't be managed. How do we move them to another area? They had to just select one. If they did more than one, they could select other and write stuff in. But you can see here we've got using a stone boat or a sled, something like that, a bucket, hip lifters, and then other. And so hip lifters, that was just over 25% of the respondents said that they're using hip lifters as a method of, so this is not lifting cows, this is a method of moving cows. So really appreciate that respondents are honest in terms of what they're doing on farm, because of course if we look at ProAction, this is probably not in their SOP, but they're saying they do this, right? And it is lower than previous numbers. So, and that's, sorry, that number there, the bottom year is wrong. I think that's 2021 data, not 2020. But 2015 Canadian-wide survey there, that was a lot higher. So numbers are down relative to other surveys, which is good. But I think this, highlights some of the challenges between, I mean, we have requirements that have to be in SOPs, but when we look at what's actually happening on farm, there are a lot of challenges with potentially implementing that on individual farms. Talk about that a little bit more in some of the other stuff. But another thing that we looked at is how do people lift down cows. So again, here hip lifters are the most common, which I think makes sense. It's pretty much easier way to lift cows compared to bands and slings. Bands and slings definitely have advantages. The ProAction document has a large section on going through the pros and cons of different lifting types. But yeah, I think, if you're one person by yourself, hip lifters are a lot easier to use than getting bands and slings under a cow. Interesting here too that 20% don't lift cows. Is this good or bad? I don't think there's any kind of answer on that, because lifting cows in general is a good idea in terms of initially diagnosing, can the cow, is she able to stand with assistance? Because sometimes that's all it takes. In other cases, I mean, certainly injuries can occur from lifting cows improperly, hanging cows from hip lifters that aren't standing on their own after they've been lifted. So there are potential negatives to lifting cows. But yeah, I think, and this definitely could also reflect, challenges in terms of layout, where the cows are, is it possible to lift them or not? There were some people with the bands and slings that are using devices, right, that you can put together around the cow that you could use theoretically in any situation, although sometimes really challenging to actually set up. The other thing that was interesting here, so we looked at how often, and again, this is for the average cow, which is hard to talk about the average down cow because they're all so different. But depending on what method of lifting producers used, how often did they do it throughout the day? And again, with this, there's a recommended amount on the ProAction manual. Is there a real correct answer here? I don't know. I don't think, there's recommendations out there, but I don't think there's anything that's really conclusive. But generally, lifting a few times a day is probably good if they're lifted in an atraumatic way. So interesting here, definitely there were less respondents overall that are using, multi-banded situations. But those are more complicated to get on the cow. But if producers were using those, they were lifting about the same amount as if they're using hip lifters, which are, again, a little bit easier to use. Some other things that I thought were really positive that came out of the survey too was time to doing different things after identifying a cow as down. So here there's the kind of median time in hours and then the range. But you can see the median time, so that's our middle value is quite low for most of these. So, producers, if they need to, are relocating animals quite quickly after identifying them as down. If they're in a not appropriate location, helping them to stand quickly, which again is really important. Of course, it depends on the initial cause, but because of that risk of secondary damage, if cows can be lifted soon after the initial cause is corrected, that's going to help prevent secondary damage. Getting medications into them soon, and then repositioning. Again, this would be for cows that remain down after initial lifting, but repositioning within the first 4 hours. So again, of course, there's range there. So on some farms, it may take a lot longer than others, but our average values, or median values, I guess it's not quite an average, but middle values are really low. I think that's a good story. And this stuff also is maybe a little bit easier. Well, relocation might depend on what method is being done and where, but some of these things are obviously easier to do than relocating a cow if the barn really isn't set up to be able to do that. Last thing I just wanted to touch on was euthanasia decision making, which I think is a big part of managing down cows. From previous work, this is from the kind of Canada-wide survey. Most producers cite using kind of the same indicators in terms of identifying animals where euthanasia decisions might need to be made. So, not improving, not eating and drinking, signs of pain. The range of making these decisions ranged quite a bit. In the Canadian study, they all had a date. So there was no one, I think there's lots of kind of check other, right, whatever you'd like. Nobody said that they don't ever euthanize non-ambulatory cows, although some studies in the US have identified that there are producers out there that say they would never euthanize non-ambulatory animals. So maybe a little more variation in terms of when this decision making happens. And we see that in surveys of veterinarians too, where there's a lot of variation in terms of when decisions should be made in these scenarios. Again, this is coming out in our focus groups, which is great, but I think a lot of this has to do with, we have very individualized, or we look at SOPs for managing down cows. They're really individualized because they need to be for the farm in terms of what equipment they have, what their facility looks like, and the type of, like, how many people even, right, that they have that are available to help with that. So individual plans are really important. The time and effort that's available on different farms in terms of the management of these animals is different. And so I think because we have differences in how these animals are managed, probably the euthanasia decision making needs to be different on one farm versus another as well, to some degree. Also coming out in the focus groups, which is I think really important to highlight, is that sometimes this can be emotional. That managing down cows is challenging. There's well described in kind of medical literature that anyone looking after someone, an animal, or I guess maybe not on the human side, but on the animal side, looking after an animal, being a caregiver for an animal, they call it the killing caring paradox, where you're providing care, but at some point, if you're making a decision to euthanize the animal, there's sometimes people feel a very big disconnect between caring for that animal and then making a decision to end their life. And so even though I think, like, I come from the veterinary side where we have lots of time and training spent in euthanasia, where that goes on that scale, but it's certainly from qualitative research in general human populations and everything, people feel very differently about euthanasia in animals, and I think that can make it a big challenge too. One of the other challenges that's come up with this too, that's been identified, is that sometimes it's very frustrating because we have so many different reasons why animals can go down, and for the most part, unless it's a very simple case of milk fever, which is treated, the animal gets up, often there's never a definitive diagnosis on those animals. People don't know what's exactly happening with them, and so this has come up in the focus groups that people want to provide good care for those animals, and they feel sometimes lost, that they don't know how to make the next decision on them because we don't have a definitive diagnosis, we don't know what's going on. So I think that highlights the benefit of again, that SOP having veterinary involvement and kind of sharing the responsibility for making those decisions and helping have plans for those animals. Okay, so overall, yes, down cows definitely remain a challenge, but I think having individualized approaches is super helpful because there's so many differences between farms with how those animals are looked after. I think from our survey, we definitely see lots of positive things in terms of improvements, and also just by the nature of having requirements and proaction allows opportunities for conversation, and I think in many of these cases, having those conversations can relate to improved SOPs and improved care. And then yes, hopefully with our qualitative analysis, we'll delve a little bit more into a better understanding of the barriers and challenges that can help with implementation of these things. Okay, so thank you for your time, and if you have any questions.